Hi, everyone. Welcome to the Community Engagement webinar series. Our webinar today is titled Community and Faith-Based Organizations, Why They Matter for a Healthy San Francisco. And our speakers today are Angela Gallegos Castillo, Kent Wu, Chanel Williams, Roberto Vargas, Abby Cabrera, and Jonathan Butler. So our agenda for today is first housekeeping and brief announcements, followed by the presentation from our guest speakers and ending with Q&A and any closing thoughts. And so during the presentation, you will be able to anonymously submit questions for the panelists that will be read at the Q&A section. And I will also be monitoring the chat for any questions that populate there. So first, we want to acknowledge that we are on unceded ancestral homelands of the Muwekma, Ohlone, Ramaytush, and Yukuts First Nations, who are the original inhabitants of the San Francisco Peninsula, East Bay, and Fresno. As the indigenous stewards of these lands and in accordance with their traditions, the Muwekma, Ohlone, Ramaytush, and Yukuts have never ceded, lost, nor forgotten their responsibilities as the caretakers of these places, as well as for all peoples who reside in their traditional territories. As guests, we recognize that we benefit from living and working on their traditional homelands, and we wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Muwekma, Ramaytush, and Yokut communities, and by affirming their sovereign rights as First Peoples. And so I've included a QR code that also maps the native lands globally as well. And we encourage you also to donate to all of these communities as well for being on their land. We also acknowledge the exploitation of our Black ancestors who toiled on this land, building America's wealth and freedom, and survived despite never being compensated nor fully realizing their own sovereignty. And while our ancestors have survived, we also honor and remember those legacies were cut short due to genocidal anti-Black violence. We are working to repair the harms caused by individual institutions and the US government, and we honor the gifts, resilience, and sacrifices of our Black ancestors by protecting our spirits, seeking light and laughter, leaning into love, and investing our collective legacy. And so I also want to highlight folks on our CTSI community engagement team and partners. These are just some, not all of the beautiful people who are making this work happen, and also includes some of our community partners. So really briefly, CTSI stands for the Clinical and Translational Science Institute. And we facilitate clinical and translational research to improve patient and community health. We provide tools and resources to create better conditions for diverse people to participate in research. And so how can we help? We help folks in training and career development, research services, policy, and community work, and also infrastructure and resources. And so specifically our community engagement webinar aims to support authentic and mutual beneficial academic community partnerships. And this year's webinar series really focuses on uplifting and supporting community members and community-based organizations. And overall, the goal is to facilitate knowledge sharing. And so if you're interested in a consultation, please submit a request. You can either send us an email or scan the QR code at the top right corner to start the consultation process. The first hour is free, and we would love to help you and connect you to any resources that you may need. Lastly, we're having our CTSI SF-Bay CRN and Impact Program annual conference. We're still taking registrations and abstract submissions. So if you're interested, please scan the QR code to register. And with that, I'll pass off to our guest speakers. I will also be sharing this in the chat as well and at the end of the webinar.
Thank you, Tyra. And I will go ahead and start my slides in just a moment. Thank you and welcome everybody. Thank you for joining us and welcome to our presentation. We're really excited to share with you the community and faith-based organizations, why they matter for a healthy San Francisco. It's a timely discussion, and I'm excited to share with you some really important information based on a research report that was conducted between UCSF's Family and Community Medicine and the CTSI, the Clinical and Translational Science Institute, and I'm excited to briefly share some of our findings from our recent research that focused on the vital role of community-based and faith-based organizations, also known as CBOs and FBOs, in advancing a healthier San Francisco. So over the next 10 minutes, I'll walk you through our research findings, what this means for policy and practice moving forward. And before we begin, I'll just share that my name is Abby Cabrera, and I work at UCSF in the Department of Family and Community Medicine, as well as with the CTSI. And I'm just really thrilled to be here today. And just to ground us in a little bit of some definition setting, quickly just sharing and ensuring equity and understanding that CBOs, the community-based organizations, these are nonprofit organizations that provide services in the local community and are typically funded by government contracts, philanthropy, fees for services, and other sources. Faith-based organizations, or FBOs, are local religious organizations providing community services. And so the panelists for today's session are leaders from 3 CBOs, the Instituto Familiar de la Raza, Rafiki Health and Wellness Coalition, and the Nico's Chinese Health Coalition. And before wrapping up, we'll have a Q&A session. All right, so the UCSF and San Francisco CBOs Stop COVID-19 partnership set out to document and elevate the contributions of CBOs and FBOs to San Francisco's COVID-19 response, because San Francisco gained recognition for one of the most successful and comprehensive COVID-19 pandemic responses in the US. We sought to understand what made their partnerships very effective during the time. And so we conducted interviews with over 30 leaders and staff from 17 local CBOs, FBOs, and city agencies. We approached this work with 2 goals in mind: identifying factors and drivers that promoted strong and equitable partnerships during the pandemic, and we sought to generate community-informed recommendations for how the city can sustain these partnerships beyond the public health emergency. Our research highlighted 5 major themes that together paint a powerful picture of how CBOs and FBOs shaped the San Francisco pandemic response and why their role remains critical. First, it was clear that these organizations were able to spring into action quickly because they weren't starting from scratch. They had deep roots and trust in communities that they serve, an infrastructure that had been long built before COVID hit. What was particularly striking was how many of these organizations reached far beyond their typical scope, whether it was serving new neighborhoods, addressing different cultural communities, or responding to emerging needs. They extended their impact well beyond their historical focus area. They also took on work that wasn't part of their original mission. So, for example, setting up testing sites, managing food distribution, coordinating vaccine outreach, and more. These pivots were not easy, but they were essential, and they showed just how agile and committed our community-based and faith-based organizations are. At the same time, the organization didn't just deliver services, they fiercely advocated for communities. They brought visibility to overlooked populations, they challenged inequitable systems, and ensured that public resources were distributed with equity in mind. And finally, as we shift into a post-pandemic landscape, many CBOs and FBOs expressed deep concern about looming funding cuts and a return to being sidelined in the public health ecosystem. There's a real fear that the gains made in community power and cross-sector collaboration could be lost if we don't act intentionally to sustain them. And this is a snapshot of the organizations and city agencies that participated in our interview. At the end of the webinar, I will share a QR code to access our report and encourage you all to read and review it. As you see in one of the quotes, a CBO representative shared, what we came to realize was that that seat at the table was temporary. And these findings don't just reflect what happened in San Francisco. They help us understand why our local pandemic response was so effective and what's at stake if we don't sustain that progress. First and foremost, the research affirms just how pivotal CBOs and FBOs were in shaping a successful community-anchored model here in San Francisco. They weren't just helpful, they were essential. And what we observed locally aligns with studies from across the country that underscore the critical role of grassroots organizations, community and faith-based, in emergency response and local mobilization. That's why the research matters going forward. It highlights not only what worked, but what needs to be institutionalized. If we want lasting health equity, we need to treat CBOs and FBOs not as stopgap partners in a crisis, but as long-term co-leaders in shaping public health systems. That means stable funding, meaningful decision-making power, and recognition of their role as trusted anchors in our most marginalized communities. Many of those enabling conditions were temporary. And now, as that one-time support fades, we risk slipping back into underfunded, underleveraged relationships with community organizations. At the same time, the study also surfaces a cautionary note. The partnerships that worked so well during COVID were often made possible by an unusual set of conditions. Things like flexible funding, expedited contracts, and a shared sense of urgency about racial and social inequities. So in short, these aren't just COVID-era lessons, they're blueprints for building a healthier, more equitable San Francisco moving forward. And at the same time, the study surfaces a critical warning that the partnerships that worked so well, right, as previously mentioned, they were seemingly temporary. And now we're seeing those supports unravel. And so we're seeing the implications turning into reality that are the fears that were expressed in the interviews in 2022 and 2023 have been borne out now in 2025. We're seeing federal budget cuts to domestic programs in public health and an already straining national infrastructure. And at the local level, San Francisco is facing its own tightening fiscal reality. We're seeing direct budget cuts to community-based organizations and task forces, which are the very groups that carried out so much of the public health response. And I can speak to one of these examples, not with my UCSF hat, but as the co-chair of San Francisco Sugary Drinks Distributor Tax Advisory Committee, and that because the sugary drinks distributor tax, also known as the soda tax, is not a dedicated tax, but rather going into the general fund, the committee can only make recommendations to the mayor and board of supervisors, who in turn allocate funding. And so Mayor Lurie's proposed allocations have cut the $3.2 million funding recommendations by the committee that would have gone to community-based grants. There are now reallocations in soda tax funding to city agencies like the Human Services Agency. But these are all layered cuts from federal to state to city, and they compound the precarity that CBOs and FBOs are experiencing. Without intentional reinvestment, we risk undoing years of progress and weakening our ability to respond to the future. And so now this is a call to action. If we want a resilient, equitable health system, we must treat community-based organizations and faith-based organizations as essential infrastructure and not as optional supports. And with that, I want to ground this webinar even further, and we're going to hear directly from leaders at the heart of this work. These are the community-based experts who've been navigating these challenges long before the pandemic and continue to lead today. And so I'm excited to welcome our two moderators, Jonathan Butler and Roberto Vargas, along with our three panelists, Dra. Angela Gallegos Castillo from the Instituto Familiar de la Raza, Chanel Williams from the Rafiki Coalition for Health and Wellness, and Kent Wu from Nico's Chinese Health Coalition. Welcome.
Thank you, Abby, and good morning to everyone. Again, my name is Jonathan Butler, and I am joined by the incomparable Roberto Vargas as co-moderator, and we have as our panelists Angela, Chanel, and I know that you all can tell by our looks, my brother Kent Wu. So let's jump in. Our findings are very clear, is what Abby has shared with us, is that CBOs and FBOs, and for those that don't know, FBOs are faith-based organizations. They are essential. They are core infrastructure. They build trust where systems fail. They deliver culturally competent care when city governments don't. And so in terms of the crisis that we were in, our CBOs and FBOs, they held the line. But yet, despite all of that, they're still underfunded, undervalued, and too often unfairly scrutinized. And so let's jump in with our question, and I'll start with you, Anila. We know from our research that many CBOs, FBOs endure heavy oversight while being treated as some would suggest disposable partners. So
Mhm.
how have negative stereotypes about CBOs and FBOs impacted your organization's work? And what are concrete ways we can shift the public narrative?
Thank you, Jonathan. And good morning, everyone. Thank you. And I'm happy to be here. I think as a representative of Instituto Familiar de la Raza, a 46-year Latinx anchor organization in San Francisco, I believe the fact that we've been here for 46 years is a testament to how well we have been working in community and the role that we play in ensuring that community members have access to services in partnership with the city. So I want to acknowledge that we're talking about systems and procedures and bureaucracy that has been entrenched to the point that it does not recognize or honor the community work that's done by the many, many community-based organizations in San Francisco. We are the lifeline and the safety net for many underserved communities. And, three of us are represented here. So I just want to dispel this mainstream narrative that we've been seeing in the newspapers and have been hearing about how nonprofits are scurrying away from their responsibility or are not good financial stewards of public funds. And I just want to say, of the 46 years that we've been in existence, we have always been looking at very high standards of ensuring that we are good public stewards in partnership with the city, in partnership with the public departments that we work with. And so I just want to set the record straight. There are many bureaucratic policies, regulations that nonprofits are held to, and we are very responsible in that way. And so the reason why the local government, the public health departments, all the other departments work with us because they know that we have a trusted relationship and we can reach the underserved populations that they cannot. And also, even when they can, they know that our relationship with community is very solid. And so community members look to us for direction, for information. And COVID-19, the pandemic, was a clear example of how we were able to work with local government to ensure that residents were kept safe, they had access to vaccinations, access to food. And so community-based organizations have pivoted in strong ways to ensure San Francisco as a whole is healthy.
Thank you so much. And you said a lot about that. And I want you to sort of build on that because you and I and with the group, we've talked about the accountability burden that's placed on CBOs, which often distracts from holding public agencies responsible for their role in perpetuating their inequity. So say a little bit about that because I know you've had a lot of conversation about that.
Yeah, I want to kind of build on what Angela has spoken on, especially in the sense of communities having to take over for government in some instances and being accountable to the community. So we were chagrined to find at the start of the pandemic that Asian Americans weren't identified as a priority population. And so that pretty much meant that burden of care for the community fell on us as community-based organizations. So what we did was we formed a COVID-19 network that joined together public entities, other community-based agencies, and basically coordinated care between us. So there's a hospital, there's the public health centers, there were CBOs that serve children, youth, and families, that serve seniors. We took it upon us to make sure that the government was providing testing, again, as not a priority population. There wasn't that care that was automatically provided. So we had to do a lot of advocating to make sure that that would happen. We also went into the SROs and made sure that those people who were actually afraid to leave their rooms were going to get tested and, if necessary, get treated. So the accountability of government, I think, needs to be looked at in the same way that we've been scrutinized to do,
Thank
and
you.
also to understand the value that we've been providing.
Absolutely. And a lot of folks don't realize what CBOs actually do behind the scenes to make everything happen. And, you know, it just takes so much effort to do what most people see, you know, sort of in at face value. And Chanel, just going off of that accountability, how is accountability disproportionately applied to CBOs and FBOs in your estimation?
Yeah, thank you so much for that question, Jonathan. We know that structural inequities and issues of mismanagement exist at City Hall and have existed at other large institutions in San Francisco. Some would argue that these issues have been present a long time. I'm a San Francisco native myself, and I've been in community work now for about 25 years. So I've seen a lot over the years. With that in mind, we CBOs and community leaders do not assume that every city administration is the same and we operate in good faith, right? But currently, there seems to be a hyper focus on CBOs as a monolith, given the challenge of a few CBOs. We're being looked at with more scrutiny and suspicion than ever before, that I've ever seen. And the reality is, as Angela mentioned, is that CBOs are expected to do so much with very limited resources, but we are essential partners because we have the trust and respect of the communities that we serve. So I would say the accountability has to be bi-directional. The city and large institutions need to be accountable for their longstanding challenges, and CBOs have and will continue to be accountable for the effective stewardship of our organizations.
Thank you all. I'm going to kick it to Roberto for the next session.
Thank you, Dr. Butler, and thank you, Chanel. Following up on that, you know, one of the findings of this report is that the deep relationships and partnerships that pre-existed the pandemic really helped folks to be able to mobilize and collaborate across communities to make things happen, to improve access to testing, to vaccinations, to food distribution, et cetera. Can you talk to us, please? I mean, I know you've got experience in building partnership as a UCSF leader doing that work in the past, and then currently with Rafiki Coalition, which has been a partner to UCSF for over 20 years. Could you talk to us, please, about what authentic partnership looks like from your perspective, especially in collaborations between City Hall, UCSF, the private sector, and community-based and faith-based organizations? And maybe if you've got examples to share with regards to what authentic partnership looks like, specifically with UCSF, perhaps.
Yes, thank you, Roberto. And it's been an honor to have worked with you and the CTSI team in the past in my role as Director of Community Engagement at the California Preterm Birth Initiative. And we did quite a bit there, from building out community advisory boards and community scientist programs. And what I've learned in that process is that authentic partnership essentially has to be rooted in trust, has to be rooted in transparency, mutual accountability, and it really moves beyond performative gestures to real power sharing. And that is where community voices, especially those of historically marginalized communities, are centered in the decision-making process. So it's really about from the start, right? Like co-creation from the start, not just consultation at the very end. It's about listening deeply, honoring lived experience as expertise. Partnerships should result in tangible resources and outcomes for communities and not just the institutions. And it also requires that institutions are willing to be self-reflective, to shift power, and to be able to stay in relationship, especially when things get uncomfortable, because I know it's often challenging for institutions to do that. And that's the only way we're going to move from transactional to real transformative change. Speaking on examples, at City Hall, I've seen authentic partnership when community stakeholders are engaged early in policy development, not just during the implementation. So that means meaningful representation on advisory bodies, budget equity analysis, and mechanisms for ongoing feedback. And it was already mentioned before, but when Rafiki partnered with UCSF during the COVID-19 pandemic, I really felt like that effort was so successful because community organizations were co-leaders, not just consultants, and they were trusted for their cultural competence and deep-rooted relationships.
Thank you, Chanel. And Doctora Angela, one of the things Chanel mentioned was mutual accountability. Understanding that there are tremendous differences in power and access to resources between community-based, faith-based organizations and the city, UCSF, other large institutions, well-resourced institutions like ours. Curious, from your perspective, in what ways can we help ensure mutual accountability between these smaller community-based and faith-based organizations and those larger institutions like ours here at UCSF?
Thanks for the question. And I'm going to piggyback on some of what Chanel already has mentioned. And I'd like to start with adopting a new way of thinking. What is our frame for the largest and most impactful outcome we can make? And who should be centered? Our public dollars center community. The public dollars are for community, and therefore, people in positions of power in departments, city departments, county departments, we should all, including CBOs, and we do, center community and then create the spaces and partnerships and power sharing tables that then organically create the conversation of how best to serve community, not what works easier for me, or is the system doesn't work like that, so you have to adopt to our system. No, we need to maybe recreate the system and really think about the frame as unity. We need to do this together. We are one, pieces of the whole, but we have to work together in tandem if we are to be successful. So for me, adopting a new framework of unity consciousness and that we all hold a piece. It's not your piece is more important than my piece, but we all hold an important piece to ensure access for community, quality services for community. And so we begin there with the frame. That then helps build those trusted relationships that Chanel was speaking to. And it also speaks to centering communities' voices in the development of and co-designing of what works best. And I want to highlight DCYF at this moment because they have been a partner with Instituto and 7 other nonprofit organizations when it came to addressing peace building and violence prevention in community. With DCYF, they provided the funds. They said, here are the funds, build it as you believe violence prevention and peace building should happen in our communities and on the streets with our adolescents and TAY population. We did that with 7 other organizations. Instituto leads that collaborative, and we have created a culturally responsive, linguistically responsive network, a new network within the city of San Francisco to work with Chicanx, Latinx, Indigenous youth. And so that is one example of what we can do together when the leadership has the right frame. of not just community-centered, but community-driven solutions that, and we then know how to build in relationship and in partnership with DCYF. So in this case, and so how can we create spaces, more spaces like that? And I just want to just reiterate too what Chanel said, or in the research world, right? This is policy world, service world. We also, community also needs to be in the design, thinking, co-designing research, community engaged research, and or just research in general to for all researchers to understand community perspective, so we don't have to then, we're advising research projects after that's been budgeted, and the new ideas in the advising and the recommendations we give can not really be implemented because the budget's already been allocated to certain things. And so I guess I'll just leave it at that in terms of we need to shift our general basic frame that we are one, that we do need to work in a united way, not and equitably, right? Understanding that there's respect and dignity for every role, for every person, and for every community voice.
Thank you, Doctor. And I do want to just call out. So one of the things you said is mutually engaging in systems change that helps us advance our collaboration together. And I want to call out that each of the three community-based organizations represented on this panel have been partners with UCSF for over 20 years, including in helping us to reshape our systems and, for example, our research enterprise and how it engages with community. So thanks to all of these organizations represented here for doing that work with us for so long.
May I just add, Roberto, that after Roadmap to Peace, that was the initiative, the collaboration I was speaking to. After Roadmap to Peace was funded, then Black to the Future was funded, and then Urban Roots United, and then also the coalition, Community Safety. I'm going to miss that coalition's name. Can't help me out. Anyway, there's an Asian initiative, community defined initiative as well. So the city in its, decision makers at DCYF, and this is where leadership is needed within the system to make those partnerships a reality. They then funded for other community defined initiatives to live and to work.
Thank you, Arnold. And that certainly leads to our next section. We're going to talk about infrastructure, capacity, and sustainability. I know it's a hot topic. It certainly was one of the major concerns by many leaders during our research project. And just for a moment, I'd like to shout out Kevin and Miriam, who's a part of the Stop COVID team. They're on here as well. There have been a lot of budget cuts. And we know those budget cuts have dismantled our community-based FBOs infrastructure, especially in areas like I know we've mentioned in previous conversations around oral health, mental health, and youth programs. And the fact of the matter, these are just not budget line items. These are people's lives at stake. And I know, Kent, you talked a little bit about this, given the ongoing budget threats. How do we protect and rebuild the infrastructure of trusted, long-standing CBOs and FBOs? What are your thoughts around that?
I think we need to look at protecting part of this and not so much the rebuilding part, because if we can protect it, then we won't need to rebuild it. And just to kind of emphasize that, as you mentioned, we are part of a children's oral health task force structure that's been with the city for 10 years. So for the last couple of years, our funding has been threatened through reprioritizing or redirecting of funds from the soda tax to other priorities that the mayors have had instead. So imagine 10 years of infrastructure being taken down. So this is building of relationships with schools so that we can get into the schools and do the education there, and to also bring in dental services This is the relationships that we've built across communities, all communities of San Francisco, to work together to address the disparities in children of color. So if we can look towards protecting that and making sure that that doesn't get destroyed, we don't have to think about rebuilding it, which could take another 10 years. And to emphasize also an example of the destruction that happens. One of our partners right now, Carescent, which serves the Latino community, is dismantling their entire health promotion department because they're no longer going to receive this funding for children's oral health. So this includes not only general health promotion, it also includes work with promotoras, who are community members who are trained as health educators. All of that is going to take many years to rebuild if dismantled and not protected.
It is certainly a pattern across so many other organizations who've lost funding for soda tax. I know Roberto, yourself, and I, we're certainly part of the inaugural soda tax committee. We advocated for community-based organizations to get the funding. I think that there's still room to advocate, right? Because we know that those funding mechanisms have gone into the different departments. Chanel, just to go to thinking about, during the pandemic, CBOs, FBOs, reposition themselves not just to be first responders during crisis, but instead be funded as permanent infrastructure for prevention and long-term care. How important is that in your opinion?
Yeah, Dr. Bell, I think it's critical. And just to the point of like crisis response, I think the city as a whole needs to get out of the crisis response framework and thinking and really think long term and also think upstream. Some of the things that are really concerning about this budget is that it doesn't feel upstream. It really looks at where we are today. And we have to be able to think about the long term because we're going to continue to be in this cycle of, we have funding, then we're cutting and we're pivoting to something else. And as Kent mentioned, it really has a devastating impact on our organizations and our community. So we really want to see a long-term plan for our communities. And we know the crisis on our streets, it's not what any of us want, but we can't forget our children and our youth and our families. We can't, forget that because the youth of today could be that person that is houseless tomorrow. And as the chair of the Proposition C, our City, Our Home Oversight Committee, where we're funding behavioral health as well as housing and homelessness services, we really did a dive into the data. And this is one of the key things that we talk about is like, how do we really stay in long-term thinking and really continue to think upstream and not just be responding to one crisis after another. And I think that the political winds as well play into this. And we have to be cognizant of that, particularly in San Francisco, that with the change of an administration and with the politics shifting, that doesn't impact and devastate long-standing hard work that our communities and CBOs have done to really move the needle on some of these horrible outcomes in our communities, as Kent mentioned earlier.
Thank you, Chanel. So whether we're looking at federal cuts to SNAP, Medicaid, etc., state cuts, local cuts, we're seeing historically deep cuts to medical education, social and nutrition services in this moment. What lessons from the COVID pandemic might we be able to apply now to ensure that community-based and faith-based organizations can continue to help us address these social needs? Anyone on the panel like to respond to that, please?
I'd like to begin because we're also in a crisis now. Our undocumented community, and not just the Latino community, across the board, but we are being racially profiled. That we are in a crisis now because of this administration, the federal policies, the changes, the defunding of services. People are going to be without health care. People are going to be without jobs. there is a crisis, a crisis now. And with all of this shifting and, really questioning the CBOs, who we are literally day to day pivoting to make sure that we support the people on the ground. We had a single mother be detained by ICE and left their 17 and their 2-year-old children having to fend for themselves. And we are, as an organization, working to support them in housing and food and who their community is here in San Francisco. And this is just one story of many, many, many stories happening. And so what we need to do moving forward, and not just because of crises that we're experiencing, to build a healthier system of support for community, is that we need to remember the mutual aid that we all bring to each other, the ways that we can support each other, because we hold different parts of the solution. And if the systems here, the departments, local government, the leadership do not recognize the critical nature and essential role we play as safety nets, as portals for other systems of support, community-based organizations, faith-based organizations are the bridge to help members access other systems of care. This is not just about the CBO receiving and doing services. It's about supporting community members into other networks that will support the work. And so we need the lessons learned from the pandemic. The city needs us, and we need the city. We all need each other, right? So we all play an important role. So recreating those tables where we were talking, brainstorming, finding solutions, building those tables, ensuring that the community-based organizations and community leaders, because I also want to bring in the grassroots groups that also may not be a 501c3, but yet are very much in community. And so rebuilding those tables, and there are recommendations in the report that recommend ease of bureaucracy, the red tape that's required to be able to really truly support community members on the ground. So the restrictions on how you give funding support to families. What else? So I'd like for us to see how we can rebuild those bridges.
Thank you, Angela. Anyone else like to respond?
I'll just say that we really have an opportunity right now as San Francisco to lead and to show the country who we are and who we've been as like an innovator and a leader, policy leader. And we want to work together in partnership. And this is a critical time for the city to be investing in our community-based organizations, because as has been mentioned, the safety net is under attack. The clients that we serve depend on those services to live. And we're going to see more and more demand for the services that we provide with less resources, and that's not right. So I think that we want to see the city and the private community also leaning in to community-based organizations and providing the resources we need to fill the gaps with what we're dealing with this current administration, because we're in this second mode of crisis after the pandemic.
Mm-hmm.
Thank you.
And just want to chime in. I totally agree. I think we need to come to a solution as one. So if the government is not initiating it, maybe we need to. Maybe we need to bring the city to the table and say, what is it that we can do together right now to address this crisis?
Mm-hmm.
One of the things that I'm concerned about is that it's not just CBOs that are under pressure now to get funding. It's also the local government, state government, all in the same boat. I'm also concerned that values may shift so that organizations or institutions are able to get funding. So there's a great attack on DEI. Some of our partners at UCSF now are doing what they can to scrub out any mention of DEI.
Mm.
And although something like that is a value that we hold in our hearts, if it's not written and it's not seen, it's something that could very well disappear. And we'd be at a great loss if that were to happen.
Mhm. I think education is so important. We need to educate our leaders. We need to educate our policymakers, because I don't believe, you know, we need to have faith and hope, that people understand the suffering that is happening in community. And it is a responsibility of our policymakers and our leaders in local government to understand and hear the voices of community. And so, I think anybody can, one, read a newspaper and get a wrong idea of the community-based organization, faith-based organization landscape. So I invite people to go visit a CBO, go visit the neighborhood agency, maybe in your community. You may have never walked through their doors, find out what they're doing, who they're, impacting, get involved. Right now, because of democracy, literally just, we're just seeing how this administration is attacking our community networks, our connections, our ideas of what democracy is, and the social contract. The question is, who are we as a country if we are not going to support the most vulnerable, those that are underserved? Because we know that it is not about charity, it's about being in relationship for social justice. If you're not okay, I'm not okay. It is about our relationship to each other and how do we want to live in this country and what do we want to do about it. So I would encourage people to get involved, to go to the Board of Supervisor meetings, to highlight those injustices that you believe are happening all across, in different ways. And that educating oneself is so very important during these times.
Thank you all. And um, briefly, I'm wondering if folks can speak to um, the experience of cross-community collaboration that we saw in the pandemic and that was identified in the report. Um, and if there are examples of strategies folks are deploying currently, or if there are thoughts you have about future strategies potentially in order to support those communities that perhaps are feeling particularly vulnerable or targeted in the current political landscape. And Kent, perhaps you might have thoughts just given the experience that I know we had during the pandemic of rallying to support our API community brothers and sisters when they were under attack in one particular moment during the pandemic.
I can tell you that right now we are planning our 30th annual Chinatown Community Health Fair. And every year we come up with a theme. And the first idea that came up this year was that we need to stand with our friends in the Latino community because we understand that a lot of them are not going out for healthcare, not going to school, not going to work. And so our focus this year is actually the theme of standing together for healthy communities. And we're going to make a strong effort to invite the Latino community to our Chinatown Community Health Fair to make sure that communities are standing together for our health. So we're coming up with ideas right now also, such as making sure that it's going to be a safe space. We're talking about inviting the sheriff's department to make sure that it's not going to, that folks who come in will feel safe, basically, whoever it might be who's coming in. And I think well, that's at least one thing that we're doing to show solidarity and support. And hopefully this will be something that we will be doing across communities as well. We are part of something called the Health Parity Coalitions, and there is one for the CLI community, for African American community, and for Asian Pacific Islander communities. Hopefully we'll be able to get together more often and plan what we can do together as well. It's been a while.
Thank you.
Thank you, Kent, and that's certainly a good wrap up for this certainly panel. Obviously, we know the work doesn't move forward unless we move together and we work across our various entities. And so I think um, you all you're doing the work. You're not waiting for permission. That you're already building. We've already, we're healing, we're leading, and so now it's time for institutions like UCSF to follow the lead. And I think that's what I hear from a lot of the CBOs is that no longer should you all be on the margins, but in the center and certainly a part of the decision making from the start. And so again, thank you all for taking the time to share. And I know that there is a question. I want to turn it over to Abby to lift some of the questions from our audience.
Thank you. So anonymously submitted, thank you for this insightful webinar. How best can researchers and research teams support these important efforts in a mutually beneficial way? And would like to ask, Angela, Chanel, or Kent, if anybody wants to respond to that. And you're on mute, Dr.
Yes,
Anna.
a million times webinars and still we forget. I think it's super important for researchers to, if not already engaged in relationship and partnership with community-based organizations, that you begin to do so, especially if you want to do research with and in community. And I cannot understate or overstate, I don't know which one. Anyway, it is so important to build relationship with community organizations and to ask and find out, are you interested in building relationship to do community engaged research? Some nonprofit organizations already have the infrastructure, others do not. And so I think it's important for researchers to really do their homework, begin relationship building, with the communities that you want to do research with and in, and build the community relationship and recognize the knowledge that community staff, community organizations bring to the table, and then absolutely reflect that in your budgets. We need more data. Community is very savvy about data. We have probably more qualitative, the story part, and some of us are building the infrastructure to do quantitative, and finding that partner that wants to build information about community. We need information and we need data. So let's do it together in a way that's respectful and that brings benefits to both.
I would just add that it would be great for research teams to come to the community-based organizations and find out what the research question that community-based organization has in mind, and really partner from that place, because there are questions that we have that really can help to advance our mission and to support our community and provide more data. And so I would just add to what was already said, that really come to the CBO and say, what are your research questions, and how can we help advance your mission, your agenda, for sustainability and for the long-term health of our communities.
Oh.
All right, thank you all. And I also want to share that the resources that Tyra shared, and I will pull up in just a moment, CTSI Community Engagement Program and CTSI overall also has free consultation services where we can link and connect you to community engagement. So we will share that momentarily. If there are any other questions, please do throw them in the chat in the last 3 minutes. Otherwise, I will ask either our moderators, Dr. Butler, Roberto, or one of our panelists to just ground us as we wrap up this webinar and any last call to action.
Thank you, Abby. I'll go first because I know Roberto will probably sort of end us. But I do want to mention that I know this is a research family, but behind every data point is, a mother trying to feed a child, a senior deciding whether or not they can pay their bills and their rent, a young person trying to search for safety and belonging. So yes, we believe in policy and research, but we also believe in people, and people are hurting in this time. And we need to be mindful that when we do our research, we have that value front and center. So I wanted to end with that. Thank you.
Thank you all. And in the last 2 minutes, up on the screen will be resources like I've mentioned. I know these are QR codes, but this webinar is being recorded, and access to the recording will be shared so that you can all access the QR codes. But on the left, again, is a way to request a free community engaged research consultation along with emails of Tyra and myself. And to the right is a QR code for a link to our report, and it was also shared in the chat. And also just want to highlight that Tyra is sharing in the chat links to the organization. So, there were calls to action to visit organizations, to contact organizations. And if you want, you can start with visiting their websites. But these are all local organizations in San Francisco. So they all will welcome you with open arms, walking through the doors. They have newsletters, they have outgoing messages constantly. So welcome you to join that. So with that, I want to thank again Jonathan Butler, Roberto Vargas, Angela Gallegos Castillo, Chanel Williams, Kent Wu, and we'll pass it over to Tyra to wrap us up.
Yeah, thank you guys so much for coming and sharing all the collective wisdom that you all have, and including the work that you did with the Stop COVID project and kind of where it's at now and where it's going. Also want to remind folks that after you leave the webinar, there will be a brief survey, and it's about, I believe it's only like 3 questions, but really we want to hear from y'all about the different topics in which you want to hear in the upcoming webinar. So thank you all so much for coming and spending your afternoon with the CTSI CE team, and also with the different CBOs that came here and shared their wisdom. Thank you all so much. Have a good rest of your day. Bye.
Thank you.
Thank you.